right. Good afternoon, everyone. Okay, well, first of all, I'd like to express our thoughts with Victorians during this time. I know they've been through this before and they'll get through it again just like they did. So on behalf of Queenslanders, we wish Victorians all the very best during this lockdown period. So as Victoria has been declared a hotspot, I'd like to advise everyone that Queensland also will declare Victoria a hotspot. So from 1 a.m. tomorrow, anyone travelling to Queensland who has been in Victoria in the past 14 days will have to go into hotel quarantine. We've been through this before, and I know that people understand that we have to take these measures on the advice of Dr. Young because we want to continue to keep Queenslanders safe. Anyone who has travelled through Victoria and arrived in Queensland today before that 1 a.m. will have to observe the same lockdown conditions as they would if they were still in Victoria. So that's really important. We'll be getting those messages out to people. In relation to the flights that will be coming in, there will be police there on hand to meet any flights and check people. And likewise on our roads, especially on our borders, police once again will be doing random checks as well. So please, if you're from Victoria, you'll be in a lockdown, so you won't be able to leave. And we want to make sure that we keep Queenslanders safe during this time. The only reason to leave, of course, is if you're an essential worker and they'll require an exemption. So Dr. Young will talk a little bit more about that. So on behalf of Queensland, can we wish Victoria all the very best? And I know that the next 7 days we're going to be with you every step of the way. Dr. Young?
So first, can I thank all of those people who've come forward in the last 24 hours to be tested. We've seen an increasing number. That is excellent. Please, anyone in Queensland today, anyone at all, if you have any symptoms, this is the time to come forward and get tested. We don't know what might be out there, but I do know that Queenslanders have always responded really well, and that is why we've done so well, because we have picked up the first cases in an outbreak and managed to get on top of things. So please, anyone in Queensland, any symptoms, just get tested. We've got testing sites all through the state. They will continue to be open over the weekend. Then, of course, anyone who has been in Victoria, anywhere in Victoria in the last 14 days, it is absolutely critical. If you have any symptoms at all, just come forward and get tested. That is so important. That is what will keep everyone safe. Now, anyone who's arrived into Queensland from 1 a.m. this morning had to fill out a declaration pass. Thank you very much for doing that. We will be messaging you to say if you've filled out a declaration pass, you've been in Victoria in the last 14 days, you will need to follow exactly the same process as if you were still in Victoria. So that means you must stay wherever you are for the next 7 days when it will be reviewed by Victoria, and you can only leave for those essential reasons. So if you're in Queensland, we're of course not closing schools, but you can't go to school or university or childcare, you can't go to any education facility, you can't go to work unless you get an exemption, so you need to go through the exemption team for that. You can go and do any essential shopping for groceries, for healthcare needs, etc. You can leave your home to exercise with any members of your household, only outdoor exercise though, not into gyms, etc. You can, of course, access any healthcare you need. And as Victoria has done, if you are already booked in for a vaccine, you can go and access that vaccine. You must wear a mask, of course, and you must tell them when you're turning up that you've been in Victoria so they can manage you separately. And that's only people that are already booked in for a vaccine. If you're not booked in for a vaccine, you will need to wait till that time is finished. That's all very important. Then from 1 a.m. tomorrow morning, Anyone who has been in Victoria in the last 14 days, if you're not a Queensland resident, you will need an exemption to enter Queensland, otherwise you'll be turned back at the border. If you are a Queensland resident, you of course can come back to Queensland, but you'll be going into hotel quarantine, and at this stage that is either in Brisbane or in Cairns. We don't have hotels at this point in time stood up in the rest of the state. If you've sought and been given an exemption to come into Queensland, you're not a Queensland resident, you can only fly into Brisbane and you'll be going into hotel quarantine there for 14 days. We've all done this before, we know exactly what's needed, it's kept us safe before, and I'm sure this will keep us safe again. But please, I do reiterate, anyone, no matter how mild your symptoms might be, please immediately come forward, get tested and isolate yourself till you get a negative result. That's extremely critical, and it's critical today. Thank you.
We also ask anyone who is already in Queensland, who had travelled to Victoria in the last 14 days, to constantly check the website for sites, the exposure sites. The Acting Premier of Victoria has indicated there is around 150 exposure sites currently. They're being constantly updated on their website. Even if you checked it yesterday and a venue wasn't on there that you've been to, check it again. Keep checking it regularly throughout the day if you have been to Victoria over the last 14 days, because sites are being regularly put on there. The Acting Premier in Victoria has also indicated there's around 10,000 primary and secondary contacts already. So please keep checking, because if you have been to one of those sites, you will need to follow the health advice depending on the tier of that site as to going into quarantine and getting tested. It is imperative, if you've been to any of those venues, that you do quarantine and get tested. So please keep checking that site. And of course, as the Chief Health Officer has said, whether you've been to Victoria or not, if you are feeling unwell, if you have any symptoms whatsoever, no matter how mild, please come out and get tested. We need everyone to do their part over coming days to ensure that we keep Queensland safe.
Thank you. Good afternoon, everyone. As of 1 o'clock this morning, anyone entering Queensland from Victoria must have a border pass. All flights from Victoria will be met by police at the airport, and all connecting flights will also be met by police. There will be random checks across all of our road borders also in the coming days. And as was stated by the Chief Health Officer, anyone returning to Cairns or Brisbane, there is quarantine hotels in those areas. However, if you are to return anywhere in between, you will actually be transported to those areas to do your quarantine period. I think that's enough. Any comment, please?
Okay. Any questions?
Any idea of the passengers who arrived this morning and filled out the border passes, like how many of those will go into lockdown in Queensland?
They'll be looking through those at the moment. If they arrive before 1 a.m, they have to do the same restrictions now as applying to the lockdown in Victoria.
We've seen this happening in Victoria. Queensland still has comparatively slow vaccination rollout rates. Is there some way, or is this the urgency to increase that rate?
Look, the vaccination rates have increased. Like, we're doing 6,265 vaccines were given in the last 24 hours. That's a massive increase, when last week I think on average we were doing around 2,000. So people are coming out and getting vaccinated, and that's great to see. And that's just through what Queensland's doing. Of course, the Commonwealth's doing a lot as well.
New South Wales and Victoria have done significantly high numbers in the last week or so. Is there a way that why can't Queensland?
Yeah, well, we said very clearly the other day we're in the process of setting up these mass vaccination hubs, and they'll be operating in the next few months.
They've already got theirs up. Why is it so slow for us?
We're working through all those processes, and I know the Health Minister and the Department are getting them ready, and we'll have more announcements in the coming weeks.
Do you know the approach of the AFL to relocate like we did last season?
We are speaking with the AFL, and we're more than happy to take more teams as needed. Look, just as we did last time with with the lockdown in Victoria, we are more than happy to accommodate teams where it is safe to do so. And a number of teams, my understanding is from the NRL, are moving up here as well.
Premier, the NRL is proposing a neutral venue for the first state of origin if Melbourne is scrapped. Now Canberra is being considered. Do you think it should be Canberra or Townsville?
Look, there are a number of discussions that are happening behind the scenes, and Queensland's are firmly in the race there.
Not a neutral venue, though. You can't pick the roads and
Well, no, but the grand final is always held in Sydney, so more than happy to take an extra state of origin. But look, let's have those conversations. They're happening now behind closed doors, and let's keep them there for now.
Can I just ask,
Yes.
or maybe Jeanette, about the fact that anyone can walk in off the street and have a jab at public hospitals? Why is that?
Sure. So we've been doing this for some time. We have our frontline workers are all coming in to our hospital hubs to get their Pfizer vaccines. But as we've said, as the day progresses, there will always be the potential that we have extra vaccines, because we always have to factor it on getting 5 out of the vial. If we get that 6th one, then we know we've got extra at the end of the day, and we want to make sure we're not wasting it. So we do take walk-ins. We've been doing this for some time to make sure that none of the vaccine is wasted. I would think this is a good thing, because it's about making sure more people are getting vaccinated and not just saying, sorry, but you're not part of that 1B and our frontline worker, so we're not going to allow you to get vaccinated. But with our 14 community hubs that are going to be starting up very soon, and a number of them are already operating, I think we've had over 10,000 people who are aged 40 to 49 already register just in the last couple of days, which is fantastic, and some of them are already turning up and getting vaccinated. So
People of any age can walk in off the street and have that.
but they've got to remember that there are bookings already, so if they walk in, they may have to wait. We would prefer people go to the community hubs, not to our hospitals, so we don't have long lines at our hospitals. Our bookings will always get priority, but that's why we're setting up the community hubs, so more people can get into more bookings. And I want to acknowledge our GPs, because our GP vaccination rates are significantly going up as well now that they're getting more vaccine from the Commonwealth. So when we talk about our figures, we need to look at the total figures of Queensland vaccinations, not just what we're doing through our state government hubs, and we are certainly up there. We have seen a spike in Victoria in the last 24 hours, and that's to be expected.
Are you getting enough supply from the Commonwealth?
Look, we're certainly getting good supply at the moment of Pfizer, and I know we have redistributed our AstraZeneca to GPs, so I'll let the GPs comment whether they think they're getting enough or not, but we're comfortable with the volume of Pfizer we're getting, and that's why we're able now to expand to these new community hubs.
Are you aware that people even under the age of 40 who aren't in any of the categories, they're actually able to make their bookings and go in and receive their jab? There's social media groups sort of telling people how to do it.
Look, I've seen some of those. Again, the bookings should be for our frontline workers at our hospital sites. We will take walk-ins. I'm just talking to some of our very remote councils the other day, and they got a phone call about 3 o'clock in the afternoon from one of our clinics saying, we've got some spare vaccine, do you have 5 or 6 staff you can send down? We don't want to waste any. And ultimately, what we want is every Queenslander who's eligible to get the jabs. So I welcome the people coming in and getting the vaccination, but please be mindful, we would prefer people go to either their GP if they're 50 plus, or to our community hubs, because we don't want big long lines at our hospitals.
Well, the Premier, there's some criticism about the legislative agenda this week. Why was there only one bill ready for introduction and one bill ready for debate this week?
Oh, look, we've introduced a number of bills since we started this parliamentary term. The bill that was introduced this week by the Premier is a very, very significant bill for all Queenslanders, the voluntary assisted dying bill. We have other bills on the notice paper that are due to come back shortly for debate. The bill that's being debated this week, the debt and savings bill, is also a very important bill. I hear the opposition carrying on about this. Let's be clear. They were complaining when we were doing 3 or 4 bills a week and saying they weren't getting the chance to talk, and now they're complaining that we're doing 1 bill a week because they get the chance to talk and they're not taking that option up. We've got plenty of legislation coming forward over the next few sitting weeks. We have budget coming up. I can assure you we're not going to run out of work. And the measure of a good government is not how many bills you've got. We saw LNP shoved many bills through when they were in Parliament, and they were bad laws. So we're very happy with what we're bringing forward. They're good laws, and we'll have plenty of work to do throughout the year.
What are some of those laws coming up?
Oh, well, I won't talk about legislation that's still coming before Cabinet and will be introduced, but we have plenty of legislation coming forward.
Sorry, Liz, have you met Trevor yet?
Sorry?
Have you met Trevor from
I have, yes.
And what was your happen with that?
Oh, look, I don't want to talk about a private conversation, but I welcomed Trevor's experience and him expressing what happened to him. And I'm very pleased with how the meeting went. You know, my Director General and I both met with Trevor, and I acknowledged that there are things we can do better in relation to his experience. And I know he also expressed that he's had many, many good experiences in our health system as well. So I welcome his contribution.
Thank you.
Thank you.
Gotta go. Bye.